Today I want to talk about exam technique. In question 1 of the FCE Use of English paper, they test you on words of similar meaning, and this can be quite difficult, especially if you get something like number 1 or number 2, perhaps even more difficult. Now, some of these are just testing collocations, as we'll see in number 3, but sometimes they're testing subtle differences in the meaning of the words. So here we have 4 words, all connected. I hope you can see the theme is medicine or illness or injury at least. Pain, hurt, injure, ache. Now, I think it's useful when you're doing this part of the exam to immediately recognize what kinds of words they are. So what kind of word is pain? It's a noun. What kind of word is hurt? It hurts. It's a verb. So it's different from pain, just like that, as simple as that. It's a verb, pain is a noun. Injure is a verb. Injury is a noun. And ache can be a verb or a noun. Okay, it's a verb and a noun. Okay, now that's useful first of all. Secondly, pain is a different kind of, well, it's different from ache, although they're very similar, and an ache is always a pain of some kind. Pain is a very general word, but we usually use it when you have some real feeling of discomfort, and it's not a tired feeling of discomfort. Ache works very well with head, tooth, legs, and maybe even back, because it sounds like you've been, well, very often we use it when you've been using maybe you've been sitting in your chair all day and your neck aches, so it's a dull pain which is not very sharp. Pain is general. It could be a dull pain, a sharp pain, it's any feeling of discomfort. So this is very specific. We usually use it with headache. I have a headache, I have a backache, or my back aches. I have a toothache, or my teeth ache. We never say that, in fact. I have a toothache, because it's a dull feeling of pain there. And my legs ache because I've been walking all day. Okay? But we use pain for the more general noun of some kind of discomfort. It's the opposite of pleasure, in fact. Hurt is a verb, and you say it when you feel some kind of pain. You can say my chest hurts, or I have a pain in my chest. Okay? Now all of these are a bit different from injure. Hurt just means you have some kind of pain. Injure means there's some kind of damage that's been done to your body. Yes, some kind of damage, and it will be a serious form of damage. We don't usually use injure for a light form of damage. We never use this word to talk about children if they've just, fallen over and maybe grazed their elbow or they're bleeding a little bit. We would never say they are injured, but you would say it for someone who's fighting in a war. You could say the soldier was injured or the soldier was wounded. It's another word that's worth remembering here. But it's like he was injured. So injure is serious. You say there was an accident on the road last night and 3 people were injured, seriously damaged, not just they were hurting or something like that. Okay, let's look at the next 4 now. Cure, treat, heal, recover. Okay, let's check again. Verb, 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 verb. Oh dear, we need to understand the different meanings here. So cure means completely get rid of a disease. So if somebody has cancer and then they are cured, that means that that means somebody has got rid of the cancer. So at the moment we don't have a cure. It's also a noun. We don't have a cure for cancer. We don't have a cure for AIDS. And of course there are a number of other diseases which we don't have a cure for. Maybe we have treatment, which is not necessarily a cure. Okay, so maybe radiotherapy or something like that. It's treatment. It's not necessarily a cure. Maybe the patient will recover, but it's not necessarily a cure. It's just a form of treatment. So treat is the process of doctors trying to help you, of them administering medicine or pharmaceuticals, or of them even giving you an examination. They are treating you when you're in hospital. And hopefully they will cure you, but not necessarily. Okay, so treating is just a doctor looking after you. Curing is a doctor looking after you and being successful and getting rid of the disease. Okay, heal, I think, has two meanings. Firstly, when you're hurt, really. When you're hurt and you have a cut, maybe not a very deep cut, it may take a day or 2 days for the cut to heal. And it means to get better, for the skin to heal. You can also say it will take a few days for the skin to heal. So we use it for cuts or skin getting better. Some kind of injury on the body, but it could be quite minor. It could be a very minor injury, healing on the body, or it could be something major. Yeah. The second meaning is we also talk about spiritual people or religious people treating the sick. We don't say Jesus treated the sick. We say Jesus healed the sick, and it means he made them completely better. It's closer to cure, really. But we use heal for spiritual people. Like Jesus, but it could be someone else. You could say that he has a special gift and he can heal people with his hands. Yeah, something like this. Okay, so heal has two meanings, and recover, it just means get better. But get better would be the informal way of saying it, and recover from, don't forget the preposition, it would be the formal way of saying for it. It took him 3 weeks to recover. Okay, I hope that's clear. Quick, short, brief, rapid. Now, these collocate differently. We talk about, for example, let me just find some. We talk about, well, actually, let's do another one here. Let's also do fast. We talk about the fast lane. Yeah, in a car, you can be in the fast lane or in the slow lane. We don't say the quick lane. We don't say the short lane. We don't say the brief lane. We don't say the rapid lane. We say the fast lane. It collocates. But we do talk about people having a quick coffee or a quick chat. So they collocate well with quick. You don't normally say, I had a fast chat to my boss. You could say a brief chat. That works. That collocates well. But not really the others. Okay, so a quick chat or a quick coffee. A fast lane. Short collocates well with a short man. Yeah, it's the opposite of tall, really, or the opposite of tall. Somebody's tall or somebody's short. But a short man or a shortcut is quite a good one to remember. If you take a shortcut, it means that you take a quick way home. Yeah, quick way works as well. You take a quick way home. You take a shortcut. Maybe you walk through the woods and take a shortcut. You don't go along the road. Okay, brief works very well with a brief glance, which is a quick look. Yeah, a brief glance, or a glimpse, which is the same. It's a synonym of glance. Or you could also say a brief encounter, because it's the name of a book or a film, not sure which one. But it collocates well. An encounter is some kind of meeting, usually which hasn't been arranged, but an unplanned meeting, a spontaneous meeting, an encounter. Okay, rapid works very well with some words. We talk about a rapid change, a rapid increase, rapid growth, rapid progress. Okay, so there are lots of ones which collocate very well with rapid. Now let's talk about the last four. Increase, raise, rise, enlarge. These are actually different meanings again, slightly. Although increase and raise are very similar. Firstly, raise collocates with a few words. Raise money, raise your voice, raise your arm. Okay, that we don't say increase your arm, we don't say rise your arm, certainly not. So raising is when you put something up. Your boss can raise your salary or he can increase your salary, but he doesn't rise your salary. Your salary rises. So this is the difference between raise and rise. Your salary rises. We often say the sea level is rising, something like that. The sea level is rising, or the sun is rising. Yeah? Nobody's making it. Nobody's picking it up and raising the sun. The sun is rising. Okay? Lastly, enlarge would be to increase in size. Okay, that's what enlarge means, to increase in size. So you could enlarge your office, or you could enlarge your car, or something like this. Okay? Okay, I think that's enough for today. If you have any questions, please leave them under the video. And please subscribe and like if you'd like to see more. And go to my blog if you'd like to try some questions on this grammar. Thanks very much for watching. See you soon.